Modern advances in critical care nutrition, the science behind high tolerance. That is what we are going to talk today. And I'm Dr. Eileen Canday, and critical care nutrition expert who's going to speak a little bit on how we can manage tolerances. So today I'm not going to talk about the different types of tolerances, but I'm going to talk about what you can do in order to choose the right formulae for preventing any kind of intolerances. And therefore, today I have taken up certain aspects of the formula which you can choose in order for your patients to have the least intolerances. So, coming first to the elemental nutrition. Now, this is designed for patients with probably a severe gastrointestinal issue, or is a critically ill patient, or has a complex metabolic need. So the elemental formulas, these deliver proteins in the form of free amino acids or smaller broken peptides so that they are able to consume the simplest nitrogen sources available. So free amino acids require no enzymatic digestion. They bypass the functional pancreatic or the brush border enzymes activity entirely. And this characteristics makes these formula a critical tool in managing the patients who cannot tolerate standard enteral nutrition due to maybe it's a mucosal damage or an enzymatic insufficiency or inflammation that has compromised the gastrointestinal tract of the patient. Now, this characteristics also is very important in when you are choosing the right formula, because an elemental formula is a critical tool in managing the patients who cannot tolerate because of the mucosal damage. Maybe they have an enzymatic insufficiency, or that they are inflammatory, because of that they have compromised GI tract. So therefore, it is important for them to understand. Now, this there is a direct absorption in the proximal intestine. So these free amino acids are absorbed directly via the active transport mechanism in the proximal jejunum without actually requiring prior hydrolyzation. And therefore, the candidates for this population are people who are severely GI compromised, or they have mucosal damage, or they have a short bowel syndrome for that matter. So the rapid efficient nitrogen delivery supports these positive nitrogen balances in these patients. Then these free amino acids, which are the small protein units, they are carried by a minimal antigenic potential. That is an important characteristics when you consider patients with immune mediated GI conditions or any heightened mucosal sensitivity. So these amino acids are, they support the enterocyte, they support enterocyte regeneration and improve the mucosal integrity. So basically, when we are talking about reducing the antigenicity or the mucosal recovery, when we're talking about like what is antigenicity, it means that it's the ability of the substance to trigger an immune reaction in the body. So, large or complex proteins can sometimes be recognized as foreign by the immune system, and they may just aggravate the gut inflammation. So, when you say a free amino acid, they are small building blocks of proteins because they are broken down into the simplest form, and they are likely to less trigger the immune response in the digestive tract. And this is called what we say as low antigenicity. Okay, now this is very helpful in patients when you find their intestinal lining mucosa is damaged, inflamed, because the gut cannot absorb nutrients without any additional irritants. Okay, so these amino acids, they help in repairing, regenerating the intestinal cells, what we call as the enterocytes, and they improve the strength and the healing of the intestinal lining. Now, in certain clinical situations, where is it helpful? So, if you take a patient with short bowel syndrome, yeah, whether a large part of their small intestine has been removed or cut, or it has been damaged, so the surface area of absorption becomes very little or very small. Now, because the free amino acids, they don't need the digestion which a whole protein would require. They can be absorbed very quickly with the limited intestinal surface area that they have. So they don't have such a long surface area which other people have. So in that limited surface area, it is so it helps these patients to receive adequate nutrition. Then there are some patients with mucositis, or we can say the inflammation to the damaged mucosal lining. It could be chemotherapy, radiation therapy. Sometimes certain illnesses itself cause mucositis. Okay, so these amino acids, they are gentle and they are non-irritating for the intestinal linings, which are very, very sensitive. Okay, the other good candidate for elemental nutrition is patients who have inflammatory bowel diseases, maybe Crohn's, ulcerative colitis. Okay, they cause chronic inflammation of the intestine, these intestinal IBD. And when we say IBD, these free amino acids, they have a low antigenicity and they reduce the chances of stimulating the immune system, and therefore they help to decrease the gut inflammation. Even in patients of post-operative recovery, that is, if they have undergone an intestinal surgery, you know and this gut needs time to heal and to adapt, so these are the right candidates whom you can offer an elemental nutrition. You can offer free amino acids, and these elemental nutrition, they support the healing of the intestinal lining. They do maintain the gut function, and they prevent, and in the final aim of us is to prevent any muscle loss. So therefore, for people who are sensitive, they require lesser digestion, or they need easy absorption. Those are the people who would be a good candidate for getting these elemental nutrition or amino acids. uh, the differentiating factor is what I would say is the osmolarity, which is a key determinant of any enteral formula tolerance. So hyperosmolar formulas, they do increase the luminal osmotic pressure, and they draw the water into the intestinal lumen, and they could cause this abdominal cramping, bloating, or even in some cases an osmotic diarrhea. So there are many elemental formulas that exhibit an osmolarity value, and sometimes it may also exceed 600 milliosmoles, which may contribute to a gastrointestinal intolerance or interruption. And therefore, we need to give the osmolarity that is suiting the gut. So osmolarity, which is an important aspect. So when we say 300 to 400 milliosmoles, these is an isotonic relatively to human plasma. Now human plasma is 285 to 295 milliosmoles per kg, and this represents a substantial reduction compared with the other formulas who may have very high. So when you're reading your label, just take one glance of what is the osmolarity of that particular formula that you're trying to feed your patient. Okay, so anything between 300 and 400, which is very close to the human plasma, is something that you should be looking for. So lower osmolarity, they do improve the gastrointestinal intolerances or tolerances. They reduce the luminal osmotic fluid shift. Okay, these they do refuse the fluid shift. The other aspect, when you are choosing a right formula for people who are sensitive to the gut, is the MCT. We all are using MCT randomly, rampantly, and they have a unique metabolic property that distinguishes them from the long chain triglycerides. Why? Because they do not need the bile salts for mediating the micelle formation that can be absorbed when the pancreatic lipase activity is impaired. So, if the pancreatic lipase activity is impaired, they are the ones which we should be looking at, and they get transported directly to the liver via the portal circulation. Okay, so rather than through the lymphatic system, they go through the portal system, and this is what we have to remember, that in the liver they are rapidly oxidized, and they could be used. So MCT, they have these different properties that is very different from the LCT, that is the long chain triglycerides. Okay, they are hydrolyzed, absorbed more rapidly, they do not require bile, and these are some of the characteristics that we can see. Also, that the MCTs, we just understood that they do not require, nor they require bile salts, nor they require a pancreatic lipase. They are directly absorbed into the portal vein. But now they are useful in medical conditions where fat digestion or absorption is impaired. So, I'll give you a situation, say pancreatitis. Now, in pancreatitis, there is basically the inflammation of pancreas, and normal fat digestion requires pancreatic enzymes. Okay, so here is where you can have the MCT help you, because you don't need the pancreatic enzymes. You have reduced stimulations for the pancreas, and therefore you're providing energy without worsening the inflammation, and this makes it useful even in both situations, if it is an acute pancreatitis as well as the chronic pancreatitis. Also, when you're talking about chylothorax, whether there is lymphatic fluid that is rich in fats, that's a chyle leak, which accumulates, that in these situations also, when you want to bypass the lymphatic transport system, you can use MCT, this thing, fat as a source of energy or source of fat. Hepatic dysfunction patients with liver diseases, bile product and fat metabolism impairment, they too can be here. Also, you can use the MCT oils, so, or MCTs in either powder form, oil form, very various forms, or the formula itself will have MCT as a source of fat. So, you can choose your cases like cystic fibrosis, short bowel syndrome, pancreatitis, bile acid deficiency. Okay, these are some of the situations where you can remember that, here you would want to use MCT as a source of fat. When you talk about the source of carbohydrates, there are many sources of carbohydrates. The most common that is observed on on the medical nutrition therapy boxes that we see is isomaltulose. Okay, we know that it is a disaccharide. It contains glucose, fructose linked to the alpha 1,6 bond. Now, the slower the digestion results in a gradual, sustained release of glucose into the bloodstream, and therefore we have to give a slow release glucose to the bloodstream, and therefore, you can use these kind of carbohydrates. Also, talking about the digestion and absorption in the small intestine. Remember that we talk about gastric intolerances, bloating, or gas formation. So there is minimal colonic fermentation which reduces this kind of gas production, and therefore its slow enzymatic hydrolysis produces low glycemic response and sustained glucose release. Okay, rather than a very quick uh, glucose release, and this property would be an advantage in the clinical context, because it will it can reduce the stress, hyperglycemia, the insulin resistant, post surgical metabolic management is always better in this situation. Then comes to the enteral formula with, sometimes you want to choose your formulas with a low renal solute load, because you may find that you're able to give everything to the patient through a particular formula, but that particular formula, which is like your best formula to use, may have a very high electrolyte content, and then you are stuck. So when you are, if you have some formula which also has these properties along with a property that will have a lower renal solute load, is always important, because it reduces the amount of water that is required for the renal excretion of these solutes, okay, these dietary solutes, and therefore they decrease the obligatory urine output, which when combined with an energy dense macronutrients, they will allow nutritional targets to be achieved even with a low total fluid volume. So, we always face this one problem in the ICU where we want people to have lesser volume and higher calories and protein. So, this is one thing which you can look at: low electrolyte load and concentrated feeding designs. Then, in a concentrated enteral formula, the energy density is important because it allows you to feed at a and deliver nutrients at a lower lower formula and lower liquid, and the nutritional targets can be achieved even with a reduced fluid volume. And this particular is relevant in special conditions when you have uh, you know kidney dysfunction, you have liver dysfunction, some patients have ascites, some patients have a heart failure, or their ejection fractions are fluctuating, they have a restriction because there could be fluid balance even during mechanical ventilation. So these are some of the issues when you can you can use an energy dense formula. Also look at the other aspects, besides macronutrients formulas, you also look at the micronutrients which support the physiological process. It could be an anti-inflammatory signaling, it could be intestinal something that helps the intestine. So there could be many things. One of the aspect that I found particularly very useful is the role of DHA and ALA. So whether it is anti-inflammatory action that you're looking at or neuroprotection that you're looking at, these are two important bioactive nutrients that influences the formula sometimes. So look at the amount of docosahexaenoic acid or the alpha lipoic acid. Both play a very important role in reducing the inflammation and protecting the cell from oxidative damage. Okay, so these two, yes, you could be worried about the vegetarian source or the non-vegetarian source. Take a look at what from where the source is coming. Okay, whether it is DHA, that is the omega 3 PUFA, or whether you're looking at it from the algae source or another vegetarian source. If your patients are very particular of vegetarian sources, we do have a lot of patients who are particular for giving them from a vegetarian source, and therefore we take a look at the source from which the DHA and the ALA is coming. L-glutamine is always been a controversy, but remember that it is a free amino acid, and it is available in the body, in abundance, and it serves as a primary metabolic fuel for the rapidly dividing cells, especially the enterocytes and the immune cells. So when there is a period of severe metabolic stress, especially for patients trauma, critically illness, here the endogenous glutamine stores may become depleted. And if it is an essential amino acid and you're endogenously producing less glutamine, it is obvious that you need to give it from outside. So in these situations where you need an exogenous supplementation, do consider looking at the glutamine levels also of the supplement. Besides that, besides glutamine, we also look at the hepatic and cellular signaling nutrients: taurine, inositol, choline. Okay, these are bioactive nutrients which support the mitochondrial function, antioxidant defense. Basically, inositol participates in the intracellular signaling pathway. Okay, and also together these nutrients contribute to the mitochondrial metabolism as well as the hepatocellular integrity. So these are required for the cell functions. Of course, you can go on, but some of the important other nutrients which I have found of great usefulness when I am choosing a right supplement is lycopene or beta carotene, which are antioxidant, very powerful carotenoid antioxidants. They protect the body from oxidative stress, chronic disease. Especially lycopene is noted for two major conditions. One is cancer and cardiovascular diseases. Okay, so as we know, it is a precursor of vitamin A. Of course, eating a balanced nutrition is important, but when you're giving it through the tube or you're giving it through the powder, through reconstituted powder form, you have to look at these two aspects also. Because when we talk about immunonutrition and metabolic recovery, we'll talk about L-carnitine, selenium, and other micronutrients. This thing. So these basically are an entire ecosystem that will help and take care of your immune nutrition as well. Thank you for listening to me, and thank you for Academy of Nutritional Sciences for allowing me to give this lecture and this talk on a very useful topic. I'm sure it will help you. If you need to know more, please do get in touch with me. Follow the Academy, as well as if you need to buy some of my books, which I've written on swallowing, also on transplant nutrition, and on vegan recipes. You can get in touch with me, or just message me. I'll help you out. These are some of the social media sites where you can get in touch. And I thank you for this patient hearing. There are more lectures coming up on critical care nutrition. If you want to join the critical care nutrition advanced nutrition course as well as the basic nutrition course, both are available on the Academy of Nutritional Sciences. Please go and register today. Thank you so much.